subscriber. If not, this is your opportunity to join the Lebkhile Mabotja family, and of course hit the notification bell so that you can be the first to find out when new content is uploaded. Today, we are going to talk about what it's like to have a baby in ICU, which is ICU for the babies, or I think they call it a neonatal ward. In terms of what happened prior to me going in to give birth, my baby came early and it was an emergency C-section because at some point he stopped growing. So I came into the doctor and he had said to me, listen, if on Monday the baby's not growing, I'm gonna have to take him out because you run the risk that once baby stops growing and stays in there, that you lose them. So we then went in for the Monday appointment, and this was literally after my baby shower on the Saturday, and I was trying to eat as much protein as possible to get baby to grow. I was on some meal shake and all of these things, and it just so happened that the thing that got me to the doctor for him to see that baby's not growing is that I fell. Story and video for another day. So he says to me, we need to take baby out. So I didn't take my bag to the hospital because I was in denial. Went back home and we got together as a family and we prayed. Obviously, I was terrified and went back to the hospital. It was COVID time, so literally you get dropped off and that's it. The doctor had said to me, I'm going to pump you with steroids just to make sure baby has enough to help him out so he can breathe on his own when we take him out. So the Tuesday, which is the following day, I think I was on steroids the whole day. And then doctor came in to check and he said, okay, we're going to take him out tomorrow. That Tuesday night, there were problems with the heartbeat. There was a lot going on, and it kept being a threat of, okay, baby needs to come out now, or the doctor's waiting, okay, it's 2 a.m, we might have to take him out. And then the heartbeat was settled. Anyways, then we were scheduled for 3 p.m. 3 p.m, wheeled into surgery, and by then I had sobbed, I had cried, I had prayed, I had everything. But at this point, we had known that baby is going to need the NICU, not neonatal, which I said earlier, which is wrong, NICU, because he was small from what the doctor could see with his measurements, and we didn't know if he's going to be able to breathe on his own. So I was supposed to go to Park Lane, and due to the fact that they didn't have beds available in their NICU, is the reason that I stayed where I was, which was Garden City Hospital. So 3 p.m. we go. I had surrendered to everything, which is just a big message to all of you expecting moms is we have birthing plans and then life happens. Go, take baby out, and it was a very tough surgery just because of my previous operation that I'd had and the scar tissue. It was difficult for doctor to get to him. I had had obviously an epidural because I was having a C-section, so you can't see there's a cloth that gets put up. And at some point, I hear them saying, he's out, but then I didn't hear crying. And obviously now I'm freaking out, I start sobbing. And the pediatrician is like, hold on. And just so you know, in the room was a pediatrician, the anesthesiologist, the main surgeon who's my gynecologist, his, co-surgeon or assistant surgeon, if we could call it that. There's a lady whose job is to, I think she's like another nurse that helps the doctor with something. But in total, I think we had about 6 people in the room, especially with these possibly complicated deliveries. So the pediatrician said, hang on, just hold on, because now I'm like, why isn't he crying when he's out? Eventually you just hear this little squeak of a start of a cry, and then you're so relieved. And obviously they were possibly rubbing him and getting him to breathe. And the doctor did tell me before, he doesn't spank babies. There's no need for papa, if that's what you're imagining. They just rub baby and he gets alerted to the fact that it's time to breathe, especially when it's not like natural birth where there are all these things happening that help baby to know it's time, it's go time breathe, all those natural things. This is an unnatural way of delivering, but still a very good choice if it's required. So now baby's out, and then they bring him to me, and I was desperate for that skin to skin. So she put him on my chest for a very short time, and he was so tiny, and she immediately said, you can't stay long with him because he's too little and he needs to go straight to ICU. So it was just quick tears, gave him a kiss, and just you're in shock, and then they take baby away while the doctors finish up what they're doing, and then afterwards they wheel you to your ward, and then that's it. You're like, so what happens? You know, because your baby's gone. And then they're like, no, now you rest. So I'm sure we're out of there later in the afternoon after 5, and then they're like, you just rest now. So at that point I was letting family know, and you're alone, I was letting family know that he's born, he weighs this much, he's doing well, and then I slept. And by now, fell asleep briefly. They come with the machine to pump because baby's in ICU, and they're like, rest. Pump milk, which wasn't that much milk, and it's so weird having somebody be like, okay, start pumping, and you're like, I've never done this before. And close to me delivering, I was constantly squeezing my nipple trying to see if there's milk, and there was never milk. So you're also praying there's milk. And then after that, they take the milk away. In the morning, now, so you know, if you're going to have a C-section, doctors encourage, nurses encourage that you get up and walk. I made the effort because you're on a catheter when you come out of ICU. Actually, I was out of a theater. I actually had the catheter when I was going in. They shove it in so that, because obviously you're basically dead from the waist down. You can't feed anything. So at some point they tell you in the morning they're going to take the catheter out. So you don't even have to wake up to go pee. That I'm anxious, but they do wake you up to pump milk. First thing in the morning, less than 12 hours after my surgery, I was up and walking because I was like, when can I go see my baby? Other people in my ward, their babies were with them, and I was having anxiety, and you're still like in a daze of the fact that you had a whole human being and you briefly saw him. So then I think what happens with NICUs, there are visiting hours. So it could be like 7, 10, 1, and then 4, and then some other time. And they limit the time, obviously, because there are babies in there who are terribly ill. They limit the time so that the nurses can do their work. So at that time, I was there, immediately ready to go see baby, and they don't have the bag at all. They literally use the diaper that you gave them, and then they ask for a packet of diapers, which we gave to them. And then you go in, and they encourage skin to skin bonding. So I went in with my hospital gown so that it's easy to just open the gown to try and breastfeed and to have him on my chest. And that whole time, that's all I did. He's in a diaper and nothing else, but he's got all these things connected to him. So there'll be a chair not quite like this one, but like the one I'm sitting in now, and next to his little bed. And when I went into ICU the first time, they really were like, are you the mom? Are you? And I was like, yes, check my tag. And then you go in, and they're very, very strict. One parent at a time. It's not often that even the dads or grands or anybody is allowed in there. So in that time, what I love, every single bed of baby has a nurse that is dedicated to your baby. So you meet your nurse. My nurse was absolutely amazing, and she tends to you in that time. She comes to ask you, okay, let's try and feed, or she'll say he's already had a feed. We had to give him formula, obviously, because I didn't have milk right at the beginning, but we've been giving him milk, but they try to encourage you to feed and bond, and that's all you do. You sit and bond, give kisses, take pictures, and they update you. And he was so tiny, he was so small, less than 2 kilograms, but doing so good. And it's so amazing how when I came to him and I started speaking, he heard my voice, and he recognized my voice. Mind you, I didn't spend the whole night with him. Please note that this is part 1 on having a baby that is in an ICU.